Hey guys, welcome back to another video. Today we are going to talk about USMLE, that is United States Medical Licensing Exam. So it is a 3-step procedure that tests you against basic and clinical subjects. There are 2 types of boards that are responsible for conduction of this examination. One for the medical students from US and Canada. The board which is responsible is NBME or National Board of Medical Examination. For IMGs, International Medical Graduates, that is students those who are graduated from different parts of the world other than US and Canada, the board responsible is ECFMG, Educational Commission for Foreign Medical Graduates. So now we will look into the eligibility criteria. So to be eligible to take USMLE Step 1, Step 2 CK or Step 2 CS, you must be a medical student who is officially enrolled in or a graduate of US or Canadian medical school program that is accredited by the Liaison Committee on Medical Education. For IMGs, International Medical Graduates, your school should be mentioned in the World Directory of Medical Schools. Second, we will talk about the structure. It is a 3-step program. Step 1, the students from US and Canada, the expense will be $610 US. For IMGs, it will be $910 US plus $150. Because the examination paper is being couriered to your country. So after applying for step 1, you will have 3 months in which you have to choose one date and give the examination. So if there is any problem or you feel like you need more time for preparation, you can extend your eligibility period by paying $70 US. If you can't give the examination even after the extension, then you have to reschedule your exam by paying $500 US. Now we will talk about the exam structure. So it will be an 8-hour long examination, MCQs. There are 7 blocks of tickets, 1 block for 60 minutes. So total questions is 40 into 7, 280 questions, and the qualification score is 192. Average score for 2019 was 216.7. Another important note, once you have passed USMLE Step 1, you can't reappear for the next 7 years. But if you fail or get below 192, you can give it again after 3 months. The subjects that will be tested for Step 1 are microbiology, pharmacology, biostatistics, pathology, biochemistry, anatomy, physiology and behavioral science. Then we have other sub-subjects like nutrition, aging and genetics. Now we will talk about Step 2. Step 2 structure. So Step 2 is divided into 2. Step 2 CK and Step 2 CS. CK is clinical knowledge. It will be an MCQ examination. CS is like clinical skills, like examining patients, etc. So the expense is $610 US for students from US and Canada, and $910 plus $150 for IMGs, in which $70 is for extension and $600 is for rescheduling. Now Step 2 CK, it is a 9-hour long examination, 60 minutes per block, and total number of questions will be 350, and qualification score will be 209. Important note, you cannot reappear for this exam once you have passed, and the subjects for CK include, Step 2 CK include obstetrics and gynecology, pediatrics and internal medicine. Now Step 2 CS, this test examine your clinical skills, like how you are able to communicate with the patients and to diagnose them or treatment, etc. Important note, for Step 2, the person has to go to US. You will get 12 patients and will be tested on our communication skills, English proficiency, clinical encounter, and for now next one is the Step 3, which will happen after matching. Matching is what is matching? Once you have done with Step 1 and Step 2 CK and CS, you will apply in certain hospitals and universities to start your residency, that is called matching. So we'll give some interviews, we'll put our Step 1 scores, research papers in front of them, and they'll select you on basis of that. Important note, that this can only be done in USA. And next one is about the results. Results comes after 3 to 4 weeks, and you can recheck your scores for $80. USMLE Step 3 exam consists of MCQs like 75% and 25% which are clinical case situations. Now what are on the exam? So the USMLE Step 3 is a 2-day computerized examination with approximately 500 MCQ questions as well as computer based case simulations CCS, which assesses your ability to evaluate history and physical exam information, order of diagnostic tests, select initial therapies and the management of the patient, etc. So the USMLE Step 3 primarily focus on patient management, like 45 to 55% of questions, and other topics include history and physical, lab and diagnostic studies. So if you like this video, give this video a thumbs up and subscribe for more content. Bye bye.